presentation is all about passing the FRCPath Part 1 exam. And the purpose of the talk, purpose of the presentation is to give you a practical blueprint so that you can pass your histopathology exam on the first attempt. Now, to compile this presentation, we've spoken to a lot of successful candidates, spoken to them about what they've done differently, how they've approached the exam, and if they were to go back in time, what would they do differently? So this isn't just one doctor's opinion, it's not just one consultant's opinion, it's bringing together lots of different opinions, including people that have both taught the exam, so this is some consultants that have been teaching for a long time, as well as some doctors that have recently sat the exam and subsequently gone on to teaching, or just some doctors that have sat the exam, passed first time, and then finally we've drawn on the experience of candidates that have in the past failed the exam and then had to resit and subsequently passed. So let's talk a little bit about the reality of the exam. There's generally 2 sittings per year. One is in the spring, one is in the autumn. Each exam has around 500 to 600 candidates sitting the exam, at least on the last couple of sittings. That's what's been the case. And on the whole, according to the exam reports released by the Royal College of Pathologists, the pass rate sits around 60 to 70%. Each sitting has around 125 questions. Now that pass rate seems quite high, so that makes you think, look, this is a relatively straightforward exam. But just remember, if 60 to 70% are passing, that means 30 to 40% of people are not passing each time. Now that's not there to scare you, but it's just to place emphasis that this is a real exam. It requires real preparation. I've known some very intelligent people that are very capable histopathologists, very capable pathologists that haven't quite made the cut. Okay, so this is really important because the exam content continues to evolve. It's important to bear in mind this doesn't reflect how good you are as a pathologist necessarily, because there are some unusual things that are tested that you might not see in your day-to-day practice. A good example of this is things like the genetic syndromes or some pediatric cases which some people might not have a lot of exposure to. So why do some people fail? I think a big part of it is sometimes underestimating the breadth of the syllabus. Some people have really good experience, say, in the core specialties, things like gynecology or gastroenterology. Some of the things that people forget to cover or don't cover in as much breadth is things like the TNM staging system, grading of certain entities, the cytology classification systems, Milan, Paris. Those are things that people sometimes don't know the ins and outs of and can lose easy marks on. And then another big area linked to that is in terms of, we've made that point that they don't cover the full breadth, but then there's an overemphasis on the classic pathology. So those core systems, whether it's gynecology, gastroenterology, there's a massive focus on those, and that is to the detriment to some of the other disciplines that candidates may have less exposure to in their day-to-day practice, and so they don't study as much. Moving on, a really big issue that we'll touch upon again and again when going through this talk is starting preparation too late. People put in the work, again, whether that's through private tutors, through courses, through question banks, through textbooks, and it's important not to leave it too late because that can make it more difficult. And so an important connecting point to that is how much question practice are you getting? Because what you ultimately want, as with any exam, is to be doing questions that are similar or as close to as possible to the actual exam. Because once you do that practice and you get used to doing questions very similar to the exam, that's when you know, because I'm seeing those questions, I've done it before. That's when you know that you're ready for the actual thing when the time comes. And it's important when you're thinking about that, trying to choose your resource, not to use outdated resource. Now, obviously, this applies for textbooks because, look, the classification systems, the way diseases are classified, particularly in specialties like neuropathology, they can change. And so when you're using someone's notes from a few years ago, they might not be as relevant anymore. So you do want to use resources that are up to date. So, a very good example is that sometimes the FRCPath dataset, you'll be looking at one from 2018, thinking it's the most relevant, and then there's been new releases and there's a new one in 2026. And so you've got to know, okay, look, I need to not look at this one because that's going to give me the wrong information. Finally, just linking all of this back to the common theme. Sometimes what people do is they ignore the newer areas appearing in the exam because this is an exam that's developing and the Royal College of Pathologists are introducing new themes and focusing on new areas as time goes along. And so it's important to stay in tune with those developments. And we'll talk a little bit more about those developments in a short while. I just wanted to highlight some of the key reasons we've seen people not pass the exam or not quite make the cut on the first time. So, look, we mentioned that point about giving yourself enough time to study. Now, the typical recommendation that I've heard mentioned and seen a lot of candidates recommend is using around 6 months of focused preparation. Now, when we say 6 months of focused preparation, you don't need to have your foot on the pedal, driving down the motorway 100 miles an hour for 6 months. What it does mean is that you're preparing with that exam in mind with ample time. So if you know you're sitting the exam in March, give yourself time from around September to start getting yourself familiar with all of the key concepts. And the way I've broken it down is into 3 separate steps. Now, step 1 in the first 2 months is laying the foundation. You are setting that basic framework. You're speaking to people, trying to understand the structure of the exam. You're looking at the syllabus, understanding what topics are coming up, what do I need to know, and you're reinforcing that with your knowledge in your day-to-day work. Whether you're looking at a breast disease entity, okay, I need to know about this pathological entity. Have I seen a case of it? Have I seen the clinical implications of this case? And building up from there. And when in your day-to-day work, you're not quite completely up to speed with things, you can have a look in Robbins' textbook, like the basis of pathological disease. I'm a big fan of the textbook. I've always found it very useful, although other people aren't as positive. I think if you don't like Robbins, I would definitely recommend resources like the pathology portal as your reference point, or even the FRCPath data sets, because they do provide you a good baseline knowledge of information. And if you're already starting to think about the exam in that way, you're laying the foundation. Now, once that foundation is set, it's really important to start consolidating. So in months 3 to 4, starting to look at questions and doing revision. Now, what should you use for questions? There are a number of different possible resources that you could use. For example, SMART.le is a very good resource with lots and lots of questions that are constantly being developed and more being added to it. However, there are other resources as well. Pathology portal gives you a good number of questions, a few hundred, and that can help you lay the framework. So it's not quite as expansive as SMART.le, but these can start consolidating. Now you're practicing those questions and you're trying to get a feel for, okay, this is what's coming up. Now, stage 3, in those final 2 months of preparation, this is when you start really gearing up and you are going down the motorway now, higher intensity, a little bit more, now very much geared towards exam technique at this point. So this is where I would focus very much on the mock style questions, and this is where having a big question bank, a large database of questions is very, very useful, because now you can start seeing topic by topic what are your weak areas, and you can focus in and you can see what are the recurring themes that keep cropping up and how do I practice. And it's really important that when you're making mistakes, you're understanding why you've made that mistake. So can I read the feedback very, very carefully and learn as much as possible from my mistake? And when I've done something correct, let me test my reasoning. Did I choose the right option for the right reason? Have I understood it fully? Is there something I can learn? Because sometimes you have that 50-50, you're trying to choose between two different disease entities or two different molecular mutations. Have I fully understood the logic of why this particular answer is correct versus this other answer? Now, the key thing here is that we've set out a framework for 6 months and we've broken it down into 3 parts, giving us equal points of 2 months for each part. But remember, this exam rewards consistency more than cramming, and some people do like to start earlier, and so you can begin laying those foundations, beginning that exam prep even up to 12 months in advance, and just working slowly and then ramping up to this final stage down the line. I've just set up a 6 months guideline for those people that find it more difficult to study over a longer period of time. But if you can give yourself longer, that can also help a great deal. And obviously when you're doing this, when you're preparing in this way, that's helping you in your day-to-day work. It's making you a better histopathologist. It's giving you sharper skill set. So when you're in the clinics, when you're in work, in the hospitals, you know how to contribute as much as possible. So we went through those 3 stages, and you can see here when we spoke about laying the foundation, a very important part was the syllabus. Now this is very important because ultimately the syllabus is the blueprint for the exam. Because when people say, oh, what will come up, I'm not sure. Remember, the Royal College has already published the syllabus and they have told us what they're going to focus on. So that really helps gear your revision, because you can build a study plan around those topics, whether it's in breast pathology, gynae pathology, respiratory pathology, etc. And when you can see that list structured, you can identify very early on, okay, where are the gaps in my knowledge? What do I not know? And what do I need to read about? Because in that way, you can really, this is the 3rd point, you can have high yield revision time because you prioritize the key areas that you need to focus on. Because obviously if there's some niche disease, it's not there in the syllabus, I don't need to read 20, 30, 40 pages of a specialist textbook understanding that disease entity that isn't a core component of the syllabus. And it also provides you a tracking progress mechanism, and this is something I find really useful. You know, if I have it on my desk, on my computer in a PDF form, I can highlight or tick off the bits that I've covered so that down the line, later on, I can see, okay, look, this is an outstanding topic. I haven't spent a lot of time revising this, or I haven't seen any questions on this. Can I go back? Can I study something? Can I look at this in a bit more detail? Because I don't want that to be my exposed weak point where I'm making mistakes on this in the exam. So just to reiterate, start with the syllabus. And this is a nice example of what the syllabus looks like. And I've taken this from online and I'll include the link below. So you've got your area of learning. So in this case, you've got the upper GI tract, and then it highlights the knowledge that they expect you to demonstrate at an ST1, ST2 level trainee within the UK. I appreciate some people are working from abroad, and so they might not have very much familiarity with the FRCPath. If that's the case, please feel free to drop us an email, drop me a message, and I'll happily respond to try and assist you. And obviously we've put in the syllabus in the description. But it highlights the key things that they're expecting you to know. And that's very, very useful because it helps you focus your revision. When you're looking through the FRCPath dataset, you realize, okay, I don't need to memorize every detail. These are some key areas which can help me focus my knowledge. And obviously, look, they've highlighted some other areas that they want you to focus on, which you might not traditionally think of when just reading through a textbook. This includes like the fundamentals of molecular biology, where you need to have an understanding of molecular pathology techniques. So whatever resource you choose, you need to make sure that you're covering these things like molecular biology, like the governance, like the autopsy, forensic pathology. So that's what's important here. Now, for me, in my personal perspective, I've always thought that the foundation textbook is Robbins and Cochrane's Pathological Basis of Disease. I've always found it very good. I find it very comprehensive, very clear in terms of the explanations. I find the pathophysiology sections actually quite interesting and very well written. I enjoy the images in the textbook, so I'm a big fan of this textbook. Now, I think personally, if you want to sit down and try to read this book cover to cover, it is a mammoth of a task. It is probably quite boring, and actually, the first 10 chapters are not as useful for the exam. Those are baseline levels of knowledge that you should already have, and so you'll waste a lot of time going through those chapters and trying to memorize things that is not going to help you as much as you would like in the exam. How I would use it to maximize your high yield revision time is as a reference textbook. So what do I mean by that? Let's say I'm looking at questions and I'm making mistakes on a type of respiratory disease entity. Let's just say, for example, I'm getting questions wrong on sarcoidosis. Then I can go back and read through that chapter just to help cement that knowledge, get it stuck in my head. Okay, fine. Now I've read sarcoidosis and I can move on. Similar concept, let's just say in hematology, you just don't feel fully comfortable with a disease entity like the different T cell lymphomas. And so you can go and read, and find that area that you find interesting. And some people, sometimes when they're finding things difficult, they find it useful just to get a comprehensive overview. That's certainly the case for me, because if I can try and get a picture of what the clinical basis of the disease is, what it looks like in patients, then the histological process that's caused, and try and link that to pathophysiology, I can create a complete picture on my head that helps me when thinking through questions and how to approach those questions, because now I've built a framework in my mind. Now, there's lots of resources, MCQ books out there like Limchi, Gupta, there's the Sternberg book, and these all are very good to an extent in that they provide a good basis to start from, and they give you some material to get you going to practice. And I definitely had, I looked through these books, especially like during maybe lunch breaks at work, just flicking through the pages, just getting a feel for them. And it can be useful, especially if you're just starting new in the specialty. It can be useful to get some knowledge in your head. The only issue is that they can be very outdated. And so some of the things like the TNM staging or some of the way they classify diseases can be outdated and based on old exam styles, and it misses some of the new curriculum content. And what I mean by that is the emerging areas, the molecular pathology, the use of electron microscopy, the changing rules and regulations surrounding autopsies, or changing rules and regulation regarding the way tissue is processed, or changing ways that the pathology lab runs in the UK. And so the risk is that it can misguide you. You learn obsolete facts, and in that way, when you sit the exam, you think you know the answer to a question, but actually you're answering it in a way that's historical and not relevant to current day-to-day practice or current regulations, governance within the UK, within the NHS. So what you need instead is something very much focused on what the exam tests, that's regularly updated, that explains things clearly and is linked to current guidelines, that focuses on the way the exam is currently being developed. One of the things that I mentioned is that there's an increasing emphasis on molecular techniques, as well as the use of ancillary testing like immunohistochemistry, in addition to things like the use of electron microscopy, which the Royal College is increasingly trying to focus on. And you want something that's very much designed for UK pathology training, ideally designed by people within the UK that have experience, have done really well, have worked as consultants, and know the governance process within the UK. That is what you need ideally. That's the ideal resource to help you smash the exam first time. Now, I think that Smartly meets those criterias, and I think it's a resource that has changed preparation for those that use it. The reason is that you can go through things topic by topic, and it's structured to map that syllabus. The explanations are really high quality, so it really focuses on why a correct answer is correct, the nature of that disease, and it pulls together some of the key resources, whether it's Robin and Cochrane's pathological basis of disease, the Royal College data sets using high yield articles, research papers, pathology outline, bringing it all together to give you the information that you need to pass that exam. And this is important as well because you don't want information overload. So it distills it in a nice, easy to read format that's understandable. And obviously, look, you revise at your own pace as many times as you need, compared with, say, some of the courses. There are lots of courses out there, like the Spheres course, the Desire FRCPath course, but Smartly has, long-term access once you've subscribed. And as I said, it's very much designed for the exam, regularly updated. Every couple of weeks, more questions are added, and it reflects the evolving examination. It reflects the up-and-coming past papers, and the most important thing to bear in mind is that it is designed by NHS-trained doctors. So this is really critical because there are some great teachers out there, but for people, especially those training abroad, you want insight from the best doctors that have passed this exam, from the senior doctors like the consultants, from the people that have graduated from the universities like Oxford, Imperial, UCL, who have come together to develop a resource that is your one-stop shop to smash that exam, pass that exam. And I think that's what Smartly does. And it's people who know UK pathology training. Remember, this is designed by the Royal College of Pathologists, and so they'll be able to help guide you and navigate this exam so you can pass first time. So why does it work? It allows you to learn things topic by topic, practice those questions so you get that muscle memory of understanding how the exam works, and muscle memory of I've practiced questions. So when you get to the exam, you're not phased, you're not panicked. You've seen it, you've been there, you've done that multiple times. And now with Smartly reaching almost 3,000, soon to be more than 3,000 questions, that's exactly what you get. And by doing that repeatedly, reading the explanations, you know your weaknesses, and that allows you to repeat. Because repeated exposure is what is going to drive retention. It's that active recall, spaced repetition, that nature where it's forcing you to ask questions and answer questions. That is what's going to make sure you can pass your exam. And that's what's different to the courses that are out there. It's not just fixed teaching sessions at times that might not suit you. It's not just limited revisiting. You get a quick course, you absorb about 10-20% of it. It's not one-time access. You choose your pace, you study when you want to. And so I think, I just really wanted to focus on this because, as we said before, one of the biggest reasons people do pass that exam is they get trapped in preparing for those classic topics, and that's where you get caught out. So Smartly has that coverage where it's going to cover some of the key other areas like the autopsy pathology, your forensics, which is a growing area, governance, how the lab works, who are the authorities, what are the regulatory bodies involved. It speaks about management, again linked to that governance role, and also about professional practice. These are all critical areas that are often ignored by people because they think it's all about the hard science to understand the pathophysiology. And these are important topics not to miss out. Now, I wanted to come back and reiterate a point about the Royal College pathology data sets, because these do matter. Remember, these provide the official standard for pathological reporting in the UK, and so they reflect real UK practice. Consultants will look through these, consultants will use these as the basis for their reporting within the UK. And so it's really important. Like, the information in these data sets communicates a lot of information on how the laboratories work within the UK. Even like the gross pathological specimens, it will talk through how to take blocks, how to take representative sections, which parts of the organ or the tissue do you want to take to have a good overall view of the disease entity so you can make a reliable diagnosis. So that's why it's really important to have a look through those data sets. There's a lot of clinical relevance. So many questions connect the histological findings to clinical and reporting contexts. And so this is where a familiarity with the Royal College Pathology datasets is really useful, especially for trainees or candidates sitting the exam from international. So they need to be able to just get a little bit more familiar with those standards, because that's what's going to help you if you're based in India or in the Middle East or in Africa and you are sitting this particular exam. Getting that familiarity is going to be very, very important. I just wanted to make this point very clear that Smartly helps here as well, because it provides you that focus material covering lots of the concepts from the data sets and providing you the high yield information efficiently, because it is sometimes overwhelming. Some of these data sets admittedly are very, very large, and it can become just as big of a task to read the whole of Robin and Cochrane's as it is to read the FRCPath data sets in their entirety. So being able to get that information from the question bank in a more interactive way is very, very useful, and again, a unique selling point for that Smartly question bank. So how do you adapt to a moving exam? Because at the end of the day, as we've said, the exam syllabus has developed over time and it continues to develop. So what applied to someone 5 years ago who passed the exam in 2020, 2021 might not apply to you today, because there are emerging content areas, as we've said, and there are newer molecular techniques that are constantly developing. And also, the exam, even though those techniques may have been tested in the past, now may become more relevant now. So I think the way to adapt to that is to use question banks and resources that are being updated. And it is particularly useful if there's someone that you can reach out to and discuss, okay, how come you guys ask this question? Why is it structured this way? Is this what comes up still? Is this still relevant? If you can have that contact point, that's very, very good. And that's very useful. That's what you want. So what do the successful candidates tell us they do? Universally, the successful candidates tell us that they are doing question practice, and that is a key component of their exam. So, that's why I've got this as the biggest bar at the top. A lot of successful candidates have told me about Smartly and how using that has been a big game changer. And we'll show you some testimonials of just that, just so you don't have to take one person's word for it. And then you've got Robin's and FRCPath datasets, which are massively important, resources to have a look at and to go through. And I think the most underappreciated resource is actually the syllabus, and that's produced by the Royal College. And so I think, the strongest preparation strategy is something that's going to combine all of these. Obviously, Smartly gives you that question practice, and then when you're finding the explanation not as useful, okay, look, or you want to dig in more deep into that topic, okay, that's the time I'm going to start looking at the FRCPath datasets to take me to the next level. And I constantly can look back to that syllabus. Okay, have I ticked that topic off? Have I understood that topic fully? All right, can I go back to Smartly, test myself more on that topic? Can I go back to FRCPath datasets, read through them again, make sure there's nothing I've missed? And I think that's the best way to prepare. So I'm going to leave you with a final blueprint. Start early. Make sure you begin preparation at least 6 months before the exam. We've given you that framework for a 6-month preparation process, but that is critical to making sure you pass it first time. Use the syllabus. That's your roadmap from day one. Refer to it, have a look, understand what's going on. Robbins is a great reference text, in my opinion. Obviously, if you have a preference in terms of the textbooks that you like, feel free to have a look and use those textbooks that you personally prefer. I would definitely recommend Smartly as a primary resource because it's FRCPath focused, regularly updated, and repeatable. So it gives you all of the key benchmarks. It's all there packaged, so you can go in, prepare, and get out, hopefully having passed the exam, smashed it, and become a better pathologist in the process. And revise repeatedly, just give yourself that little bit every day, a little bit here, a little bit there. That repeated progress goes a long mile. And practice questions continuously throughout your preparation. That's your benchmark. That's how you know how you're doing. So, yeah, I'm going to leave you with that. The key message is passing FRCPath Part 1 is not about finding shortcuts. If someone tells you they found magic notes, magic this, magic that, you can't trust them. You need to use a range of resources. Like I said, you need to have an understanding of the syllabus. You need to guide yourself to use that content to dig deeper in a way that works for you. Definitely for me, and definitely from the candidates I've heard from, Robbins is a great reference point. The RCPath data sets are a great reference point, and then have that way of testing yourself. Smartly is so good, and why I highly recommend it is because of the quantity as well as the quality. But as I said, there are other resources with additional questions that you can use to kind of build on those building blocks. The pathology portal is an example, and also those textbooks, even though they are outdated, they're another resource. I mentioned talking through some testimonials of Smartly just to kind of give you some feedback directly from people that have used it and what they've said. We can see a range of 5-star reviews here. People saying that they found it extremely useful. Truly a treasure of high quality questions. People saying thank you for creating such a fantastic resource. People saying, can't thank you enough. People saying that it made a real difference in terms of their confidence. Unbelievably wonderful resource. Really useful website for the FRCPath exam. Lots and lots of feedback in the same way. People saying one of the best resources, and people have reached out to say, when is the part 2 resource coming? So, that is in development. If you found this video useful, just give it a thumbs up, comment down below. Obviously, if there's any key resources that you think we've missed, not mentioned, let us know in the comments as well. And maybe we can make a video just talking about those resources, speak to candidates that have used them and kind of have a discussion about those, so we can give as in-depth information as we can on the best resources out there, and also so that we can make sure that Smartly and other resources know what's needed in terms of improvement, so that resources can continue to improve, so that candidates can get the best possible things for when they are preparing for that exam, regardless of where you are in your journey towards passing the FRCPath Part 1 exam. We wish you the very best of luck, and thank you for listening. Please, if you want to see more content like this video, please just like and subscribe, and obviously just reach out to us if anything is needed, like email, WhatsApp. We're always available. Take care now.